Welcome back to the Bryan Laskin podcast. I'm your host, Dr. Bryan Laskin, and I'm excited as always that you're here. And I'm excited to talk about a special topic today about what this podcast is always about, which is restoring the order of care. Because, my friends, the order of care has been messed up for a very long time. Patients don't have the information that they legally own, and dentists don't have the ability to get access to the information that they are in charge of taking care of. And today we're going to talk about something that we just don't talk about enough in dentistry. And it's a popular word right now with the kids. It's called receipts. Now, I'm not talking about paper receipts or credit card receipts, not insurance statements. What I'm talking about is proof of what has happened with the patient, proof of what was done, what was understood by our patients, proof of what moved forward, and frankly, what has not moved forward, because dentistry has gotten very good at creating receipts for things like billing, right? We know the paper trail when it comes to money, but dentistry has gotten almost completely forgotten about creating receipts for care. How can we prove what has actually been done? We can certainly prove what was charged to the patient. We can prove what was collected and what was adjusted off the insurance benefits, and we can prove what insurance is paid. We can prove what insurance is denied, and we can go back and forth because we have the receipts. But can we prove what happened to the patient after a diagnosis? What happens after that moment? Can we prove that the patient actually understood treatment? The answer is no. Can we prove the next step was clear, right? And as we all know from prior podcasts, clarity creates the decision that drives revenue, and we can't even prove whether it was clear. Can we prove that when we send a referral, that referral was accepted by the specialist, by the physician, whoever we refer them to? 37% of the time, the patient never even goes. So can we prove that? No, we can't prove when records were exchanged. Frankly, we don't even have the ability to do anything with the records ourselves, which is completely wrong. And when I say ourselves, as clinicians who are stewards of our patient's data. Can we prove the patient actually moved forward with treatment? Almost always, my friends, the answer is no. And that is a major problem for dentistry, for clinicians, for if you're leading a DSO, it is a massive problem. When you look at a spreadsheet, if you don't have the receipts, got news for you. That metric isn't on the spreadsheet. So what you're looking at is a subset of information, and half the information isn't there. Why? Because we cannot trace care. And if we can't trace care, guess what? We can't improve it. And if we can't improve care, we're losing patients after diagnosis. Now, patients and dentistry has spent decades building systems around billing. Practice management systems, that's the first thing they did, was building a billing module and a scheduling module. But they were built to document procedures. They were built to submit claims. Actually, they weren't. That was one of the other systems that had to be built, was how do we actually bill the insurance company? So we've built document exchange platforms to submit claims. And we've built systems to track balances. And they were built to manage production, collections, adjustments, and accounts receivable. So much so that we have a whole industry now called revenue cycle management. Guess what? Revenue cycle management is production, collections, adjustment, accounts receivable, and all of that matters, right? Billing matters, documentation matters, insurance certainly matters, administration matters, but none of these things, they don't even come close to the importance of care, because a claim is not care. A ledger doesn't show care. A treatment plan is not completed care. So if you diagnose this, that doesn't mean it was done and paid for, right? If you write a referral slip, that's not committed care, because the patient doesn't go over a third of the time. A chart note, even though legally it's proof, but a chart note is not proof that the patient understood. And this is where dentistry has, I think, the biggest blind spot. We have financial traceability, but we don't usually have care traceability. Financial traceability obviously tells the money story, but care traceability tells us the patient story. And the patient story is where dentistry is leaking trust, leaking treatment, leaking revenue, leaking collections. And frankly, it is eroding our industry to the point where over 50% of diagnosed dollars never actually get collected. So dentistry has a financial traceability, but it needs a care traceability, not just to elevate care, but to also elevate our financial traceability. And if dentistry can audit collections, we certainly should be able to audit care progression. And if dentistry could track what was charged, it should be able to track what happens after we diagnose something for the patient. If we can prove the money moved, we should be able to prove the patient moved, because diagnosis is not the end of care. Diagnosis is the beginning of accountability. Now, let's imagine something very common. A patient comes to your office and the dentist, if you're the dentist, identifies a problem. Maybe it's periodontal disease, a cracked tooth. Maybe it's an implant that the patient needs, or endo or oral surgery. Maybe it's a large, restorative, complicated treatment plan. But whatever it is, you make a diagnosis for the patient. The treatment's presented, and you have it. You have your system, how you do treatment planning, and you know what percentage of dentists think they do a good job presenting treatment? I would probably say 90%. And the results show a different thing. But let's say you did a good job. The diagnosis is made, you present your treatment to the best of your ability, and the patient nods. They might even seem like they understand, right? But then they leave. And you might not even know if the patient's scheduled. But this is where the system often gets weak, because patients don't say no. Maybe the patient says, I need to think about it, or I need to talk to my spouse, or I need to check my insurance, or maybe they were referred to a specialist, so we have to wait for the specialist to do something, or maybe they're waiting for you to call them about something because you're not quite sure on something, or maybe you have to send records somewhere or confirm a referral, or maybe the patient says, I need to check my work schedule or my home schedule or my son's baseball schedule. But what they're really doing is nothing, because then nothing happens. Not because people are bad or because the team doesn't care or doesn't know what they're going to do, but because the dentist did not, and not certainly not because the dentist didn't diagnose properly, but because the handoff was not traceable. The next step in dentistry today is not clear enough. The responsibility was not visible enough, and the patient slips into silence. In dentistry, silence often looks like nothing: no appointment, no response, no scheduled treatment, no completed referral, no return phone call. There's no obvious event, but silence is not nothing. Silence is a signal. It's a signal that means the patient is likely confused. Maybe silence means the patient is afraid. Maybe silence means that the patient doesn't understand the urgency of their issue, or that it's going to progress. Silence could mean that the referral may have failed, or that the patient lost confidence. Silence means that the system has lost visibility. And when the system loses visibility, the patient is at risk of being lost. That's why silence has to become visible, not to blame somebody, just like with RCM, to help the patient move forward. This is part of what I call the diagnosis to dollars gap. Dentistry spends an enormous amount of energy getting to diagnosis. We train, we go to school, obviously, to learn how to diagnose, and we have AI tools to diagnose. We document diagnosis, we take images, we chart, we treatment plan, we explain, and my God, do we explain and we explain. But after the diagnosis, the patient journey frankly becomes clear. After we explain it to the patient, we think they will go forward, but the patient may not know exactly what to do next. That happens all too often. The patient may not know exactly what to do, and the practice doesn't know where the patient stands. The specialist might not know whether the patient even was referred to them. And if you run a DSO, you might not know where treatment is leaking. Frankly, you probably don't know, regardless of the other tools that are available. And leadership may only see the problem after the revenue is already gone and it's too late, and it's not even on the spreadsheet for you to diagnose from a financial perspective. If the first time you see the problem is in collection reports, you're looking at a failure that's already happened and you don't know how to fix it. The real failure happened earlier. It happened when the patient lost clarity. It happened when the next step wasn't visible. It happened when responsibility was not traceable, and it happened when care went silent. So let's look at the enterprise size. Let's say you're a DSO and you have 50 locations. Every location is diagnosing treatment, presenting treatment. You're referring patients back and forth, even within your own organization. And you're trying to move patients from diagnosis to completed care to collected revenue. But every single location handles follow through differently. One office has a great treatment coordinator that is always on top of what's going on. Another one is short staffed. One office follows up consistently all the time and patients know what to expect. Another office gets overwhelmed. Maybe an office has strong referral relationships and patients go and they have a closed loop so that they know that that referral has gone. But another office sends referrals and just hopes for the best. They just assume the patient is going to go. One office makes sure to empower patients with clarity, but another office creates confusion. But the DSO, guess what? Over 50 locations, has the same brand, they have the same logo, they likely have the same software, even they have the same clinical standards, but the patient journey is completely different. And when the patient journey is different, guess what happens? You have variable results, very different results, different case presentation and case acceptance, different treatment plan completion, different referral completions, certainly different patient trust, and the revenue is different. And that variability is not just an operations problem, it's a visibility issue. It's a concern because leaders cannot improve what they can't see. And if you can't scale without what you can't trace. So traceability is vitally important. And here's where things get really interesting. Dentistry has tons of technology. We have practice management systems. We have imaging systems. We have AI diagnostic tools and online scheduling, payment tools, claims, communications, and dashboards. But most of this technology, frankly, I don't know of another technology other than Tooth Apps that has been built, that none of this technology has been built around care traceability. And that's what we're building at Tooth Apps, right? It was built around documentation. It was built around billing, administration, individual tasks, and I don't want to seem like those tasks don't matter. All of these tasks do matter, but what they don't do is they do not automatically create a traceable care journey from the patient's perspective. A dashboard does not mean the patient understands treatment. A reminder text does not mean the patient trusts the recommendation that you said. A referral form certainly doesn't mean that the referral was completed, and a treatment plan does not mean the patient moved forward with treatment. Dentistry does not need more disconnected activities. What dentistry needs is a clearer responsibility infrastructure. Who owns the next step? What's the next step? Did it even happen? Did the patient understand? Did the patient act? Did that referral close? Did the patient go silent? And if the patient went silent, did anybody know? Was there any notification? This, my friends, is the new standard. This is the shift that I believe dentistry needs. The next era of dental software cannot be just about record keeping. It cannot be just about billing. It cannot be just about scheduling. It cannot be just about claims. It has to be all of those things. It has to do them vitally well, which frankly, we don't even handle that well in the industry today, which is another talk show. But the next era of dentistry has to do all of these things well: claims, billing, scheduling, record keeping, better than we do today. But the next era, my friends, is going to be about care progression, from diagnosis to understanding, from understanding to ensuring decision making, from decision to action, from referral to acceptance, from acceptance to completion, from treatment plan to collected revenue. That's what diagnosis to dollars is all about. We're going to be talking about that a lot. This is care traceability, and this is where dentistry has to go. No, not more burden to any of the team members. It's no work in the office. It's not more paperwork. It's not even, it's easier. It's less complex because we will have more clarity, more visibility, more accountability, more completed care. So this brings us back to the diagnosis dollars. That's what we're doing. How do we do it? That comes back to the operating truth of care, make more, that when dentistry creates more clarity, patients make better decisions. And when patients understand their care, guess what? They trust their care because they understand it. When you confuse, you lose, as Don Miller says. When patients trust their care, they're more likely to accept treatment, right? Because they understand it, so they trust it, so they're more likely to go forward with treatment. Would you go through with something that you don't trust? They're more likely to return to your practice and complete referrals. They're just more likely to move forward with anything that's recommended, not because they were pressured, not because you're selling them, but because they understand, because the next step was clear, because somebody stayed connected, because the assistant, the system, because the systems that you use in your practice did not let the patient disappear. This is what it means to care more. It's about having systems that back you up, not you doing any more work. Because when organizations show that they care more this way, they naturally make more completed treatment. People show up for their appointments. They follow through with referrals. There's more trust, more revenue, more confidence. So let's do the CEO diagnostic for this episode today on care traceability. If you lead a dental organization, ask yourself these questions. Can your organization reconstruct what happened after the diagnosis was communicated to the patient? Can you do that? It should be simple to do. What happened after they were diagnosed? Can you see which patients stalled, were silent, or abandoned treatment? Can you prove whether a referred patient was accepted by the referrer, scheduled, showed up, was treated, or was completely lost? Can you even tell if the patient that you refer to a specialist goes? It should be simple, but my guess is you probably can't. Can your patients clearly see what they're supposed to do next? Is it clear for patients? Are you tracking care progression as seriously as you track collections? That's the rub right here. Are you tracking care progression, the patient's journey, as seriously as you track collections? Do you know where diagnosed treatment is leaking in your organization? Do you know where referrals are going silent? Do you know which locations create clarity and why, and which locations create confusion? Because your collections can probably show that. Do you have a receipt for the care journey? Or do you have a receipt only for the billing journey? Because if you can't answer these questions, your organization does not just have a reporting gap. It has a responsibility gap, and responsibility gaps are where patients are lost. Dentistry has incredible clinicians, incredible teams, incredible leaders, incredible technology, but we still have a major blind spot. We can often prove the billing story better than we can prove the care story, and that has to change now. Dentistry has spent decades learning how to track money. Now it's time to track care, because the future will not belong to the organizations that simply diagnose more treatment. It's going to belong to the organizations that complete more treatment and collect the revenue. It'll belong to organizations that create more clarity for patients, for our teams. It'll belong to organizations that make responsibility visible, and it will belong to organizations that prove care moved forward. Again, dentistry has receipts for billing. Now it needs receipts for care. And this is how we begin to restore the order of care, through visibility, through accountability, through traceability. That is how we care more, make more. And that is how we take back care and put patients at the center, clinicians right there to help manage the care. And if you don't know how to diagnose your traceability gaps, reach out to us. That's what we're doing with the Diagnosis Dollars pathway with Tooth Apps. So thank you very much for listening to the Bryan Laskin podcast. Very much appreciate it. If you agree, let me know. If you don't agree, please let me know. I love having discussions, and we've been really having an uptick in people engaging with the platforms. Appreciate everybody listening. I know it takes a lot to take time out of your day to listen, and I very much appreciate it. I look forward to seeing you right here on the Bryan Laskin podcast.